Hello, today on Tea with an ND, I am going to be talking about endometriosis. I had a client this week who has been suffering with endometriosis unknowingly for many years, and now she's doing some fertility treatments at the Ottawa Fertility Center. And she made a remark to me that prompted me to make this video. She said, it's too bad that I didn't understand that there were other solutions for endometriosis, or let's say complementary solutions, to go alongside all of the treatments she's getting with her amazing doctors at the fertility center. So I thought, you know what, I might as well just put out a video and help other women out there realize that there's a lot of options for treatment. So if you don't already understand endometriosis, or you're not quite sure if maybe you have it, some of the symptoms are extreme pain. That's usually the most common symptom that brings clients in to see their doctor. The pain can be pretty severe, and it can be felt, as a typical menstrual cramp, but it can also go up into the back, and it can be felt in the hips, and it can even aggravate the large intestine if there are endometrial lesions on the intestine. So some women will get some bowel irregularities as well. And some women will even get nauseous with the pain that can be severe. So diagnostically, it's tricky because ultrasounds can pick up cysts on the ovaries if there are endometrial cysts. They're called endometriomas. But really the best way to diagnose endometriosis is with something quite invasive. It's a surgery where they put a little tiny hole right underneath your belly button, and the doctors will go in and look around and see if there are any endometrial lesions just sort of hanging out. And if they do find some, they will remove it. So that is diagnostic, but it's also a form of treatment. But it is really invasive, and some women who have a lot of the signs and symptoms of endometriosis, and they will often just get treated right away for it. The conventional treatment is often birth control pill use with some pain relief. And some doctors will also prescribe something called an aromatase inhibitor, and it's something to help with that, to kind of bring down the estrogen that can make the endometriosis worse. So essentially what's happening in the body with endometriosis is the endometrial cells travel up the fallopian tubes instead of traveling just down with the menstrual cycle. It's called retrograde menstruation. And so those endometrial cells are flowing up through the fallopian tubes, and at the end of the fallopian tubes, they're just sort of open and ready to receive the egg from the ovaries. But there's an opening into the abdominal cavity, so the endometrial tissue and cells can travel up and settle in, and it can land on the uterus. It could land on, as I mentioned earlier, on the large intestine, and it can create a lot of symptoms, and it's very inflammatory in nature. So the pathogenesis with endometriosis is really connected to some immune dysfunction. And so a lot of the treatments are geared towards helping the body lower the amount of inflammation by modulating the immune system. And so as a naturopath, when I see clients, I definitely want to make sure that they're well informed about all of the choices that they have when it comes to treating this. And for the clients that are coming to see me in order to get pregnant, going on a birth control pill is sort of defeating the purpose of what their goals are. So I'll often do a lot of testing with them. If they've already been diagnosed, for example, with a laparoscopy or an ultrasound, I'll often do some extra testing to look at what exactly their inflammatory markers are at, and do some hormone testing. And we put together a really thorough, individualized plan for them that consists of various evidence-based supplements or herbs. Definitely working on nutrition and lifestyle, and it's really depends on all of the other factors that are showing up for them, any other symptoms that they're having. And in my practice, I always weave in some mind body medicine as well. So just to make sure that we're being thorough and treating from a real full spectrum approach. I want to always make sure that my clients are healing not only physically, but also mentally, emotionally, spiritually, if there's anything going on as far as energetic blocks or different kind of emotions that are connected to the way that the endometriosis is affecting their lives. It can be really devastating for a lot of clients, not only because it can lower your chances of conceiving, but it can really devastate your life. You may have to take 3, 4, 5 days off every month to deal with the pain. That may stop you from going on vacations or making plans at that time of the cycle. So it is definitely something to, if you're not quite sure if you do have endometriosis, you want to talk to either your medical doctor or naturopath and get properly assessed and know that there's a lot of great treatments out there. So if you have any questions at all, reach out to myself or your medical doctor. And thanks for joining me for Tea with an ND.